Шановні колеги, ми продовжуємо робочий день.
We continue our working day. The next event is on presenting the team of Ulana Suprun. Our guests are Dr. Ulana Suprun, and Acting Minister of Health of Ukraine, Oleksandr, Linchevskyi, Oksana, Syvak, Pavlo, Kovtoniuk, the Deputy Ministers. Good afternoon. On the 31st of August, the Cabinet of Ministers of Ukraine appointed the deputies to the Minister of Defense of Ukraine, Oleksandr Linchevskyi, Oksana Syvak, and Pavlo Kovtoniuk. And for a month, I have been working with the Deputy Minister, Roman Ilik, the Prime Minister, the government, and the President, by appointing the new deputies, show by their actions that they support the new team and new directions of work. We want in Ukraine the government to be made from people, by people, and for people. We are on the right way to achieve it. We are together until the end. Verkhovna Rada will soon start its work, and we are expecting to cooperate fruitfully with MPs, with the trust of the President and the work of the government. Together we'll be able to overcome many problems and build strong Ukraine. Ukraine has many enemies, external and domestic. We have to address these problems. The reforms and changes in the social sphere, health policy, social policy, sport, culture, education concern every citizen of Ukraine. The changes in this sphere can overcome the internal enemy. This reform will enhance the state structures which work for the liberation of occupied territories. We will be working together with the government. We will be all taking responsibility to execute the action plan and implement the changes needed. The principles of our activity is to set the diagnosis and treat the disease. To change the world, we need leadership, teamwork, and cooperation. We will start from trusting each other. Only the group of people with common values and vision can not just win the battle, but even win the battle. The team of the Ministry of Health is not political. These are specialists, technocrats who will be working new way. New deputies are professionals who, by their knowledge and work, proved that they can be responsible for the change of medicine in Ukraine. Oleksandr Linchevskyi is the surgeon of the hospital number 17 and the teacher of post-diploma academy. Oleksandr will be the deputy on medicine and organization of medical assistant to ATO. Oksana Syvak, consultant of health, World Health Organization, the doctor of gynecologist. Oksana will be responsible for public health and Euro integration. Pavlo Kovtoniuk is the specialist of World Health Organization, teacher of Kiev Megala Academy, was working as a project manager on the reform of health sector. He will be responsible for the reform in the ministry, and Mr. Ilik will be responsible for pharmaceutical direction and licensing medical institutions. Now I would like to request each one of the deputies to take the floor. Alexander, the floor is yours. Dear friends, colleagues, journalists, the ministry is not treating the patients. More than that, the ministry is helpless in implementing reforms or any serious changes. Every patient or the system could be treated together. We depend on common actions of all of us. We are dependent, and we request you for help and cooperation. We will be trying to support our colleagues, will be trying to help patients, but all together. Thank you. Oksana Syvak. Good afternoon. I would like to add to what Oleksandr said, that we really have to get assistance of everyone. Only common cooperation will bring us to our objective. Besides treating, we are interested in preventing diseases. We know that it's better to prevent than to treat. The public health will be what I am responsible for. There will be prevention, the correct way of life, and as you know, the public health is so important. For association with the European Union, will be working actively together with our European partners and other global partners, and our objective is to have a healthy nation. Thank you. Pavlo, Kovtoniuk. Thank you. I will be responsible for reforms in the ministry. We know that according to the results of the survey, people believe that reform of the public health is one of three priorities, top priorities. Once we're talking about reforms, the most expected part of reforms is introducing the state medical insurance in Ukraine. When I worked previously as an expert, I participated in implementing the plan of introduction of such system in Ukraine, and this plan was presented to the Prime Minister of Ukraine before we were appointed. And the fact that we are here means that we have the mandate to implement this reform in Ukraine. We have this plan. It's already drafted. Starting from next week, we'll submit it to the Cabinet of Ministers of Ukraine for approval, and from 2017 we'll launch the system of state medical insurance, when money will follow the patient, but not the bed in the hospital or the building. We have first steps made, and I will be happy to discuss it with all the journalists and explain about these plans in detail. Thank you. Thank you, Roman Ilik. Good afternoon. First of all, I would like to say that we are looking forward to the beginning of political season. We have the intention to continue our close cooperation with the Committee on Public Health in Verkhovna Rada, so that all the legislative initiatives which come from the committee, the MPs and the ministry, are consolidated and oriented, first of all, towards the citizen of Ukraine. That is first and very important thing I would like to mention. In the ministry, I will be responsible for pharmaceuticals, and that is one of the priority steps and actions which we'll be doing, because the government of Ukraine, the president of Ukraine emphasized that the citizens of Ukraine need to have a simpler access to high quality and more affordable pharmaceuticals, and we have moved in this direction. We complete our work on national policy. We have selected the experts to expert committee, which make the national list of pharmaceuticals. This will be the new list, according to which all the changes will take place on the system of reference pricing, and it is very important, the system of reimbursement, which will make it possible to make medicines cheaper. In Ukraine, these are systemic changes. These are changes that concern everything that Pavlo mentioned, the changes in the system of public health, and so we believe that this will be happening very quickly. and also all on licensing and accreditation. This is what I will be responsible for in the Ministry of Public Health. That also requires high quality changes. That is licensing the activity itself and of the workers and changes to accreditation. It will be maximum adapted to European level that we have and to the best practices that we have in the world. Thank you for attention. Thank you. Our team is ready to work. We are coming out of this building. We go to Linchevskyi 7 and we start our work there. Thank you for attention. If you have questions, we're ready to answer. Any questions? Please introduce yourself. Interfax Ukraine, Anna Lepchenko. My question is about the past. One of your first appointments was to change the head of the State Expert Center. That was quite unexpected for pharmaceutical community. Why have you replaced this head? And why wasn't there a competition for a new head of this institution? In fact, recently we dismissed the head of the expert center. There are two items. He violated the legislation. Now we have the acting head, and in the future we will announce the competition and we will appoint the head who, according to the competition, will be heading the state company. Any other questions? Once you have no more questions, the journalists can talk to our guests off records. Now, thank you, all your team, and we, the UCMC, we are ready to help you in media. Thank you.